Good afternoon from a sunny Amsterdam and windy Amsterdam. And good afternoon from...
From London. Good afternoon.
Yay. How's the weather in London right now, Jill?
The weather is very windy right now.
Ooh.
Yeah.
We have wind, but we have also sun. It's a sunny day. So thank you so much for being here.
And thank you so much for inviting, Catalina.
Yes, and Jill is for the first time with me, and now it's episode 62, Mediator 62, Rendezvous with the Present Moment. It's a place where we hope to help you get inspired, to get ideas about how to elevate your mental, your emotional, your health, your business life. So various areas of your lives to help you thrive, especially during these times, challenging times we live right now. And I have Jill Broadbent, and I'm very happy that I have her because she's such an interesting woman. She's like a ultimate people's person. She supports, she helps, she trains and interacts with people from all walks of life, focusing on sharing care, warmth, and fun, which for her are hallmarks of compassion. And as she puts it, what could be more interesting, more rewarding, and joyful than relating to other people who are sharing this journey of life? So she's also a very, very wise woman. And Jill trained initially in dentistry and then in oral surgery, and has practiced as an oral surgeon for about 25 years. And alongside her professional career, and related to many years of patient care, Jill has developed a deep understanding of communication and relationship. I'm so happy that a doctor expert in communication, because we need this. And she's the founding partner of the Center of Communication and Compassionate Communication, which offers workshops and individual counseling. And she's also a qualified mediator specializing in neighbor disputes. And among other interests, Jill is a chairman of a choral society. She's married and she lives in London. You have cats, or what? Do you have some cats? Do you have pets?
I have a very cute dog.
You have a cute dog. Oh, nice, nice. So, Jill, we're gonna talk about compassionate communication, and we have a tradition here. Before we start, we have a centering exercise, because we together a sacred experience in life. So we're gonna prepare each other, and it's less than a minute. So let's close our eyes and notice how we connect with the surface under our body. Taking in all the sounds around us. Noticing our breath in and out. And as today it's about compassionate communication, let's focus on our heart, bringing our attention to our heart. With a sense of gratitude for everything that our heart does for us during the day, beating so many times. And breathing in the area of the heart. And one more deep breath in. Breathing out, let it go, and opening our eyes. And let's start this. So, Jill, you live in London, and tell us something beautiful about London, something that you like, really like.
Okay, so something beautiful about London. I moved to London when I was 18, and when I moved here, I felt totally at home. And what I most like about London is the fact that you can meet so many people and from so many different countries and so many different walks of life. And there's such a vitality and thirst for life, I think, in London. One day I was working in my surgery and I had 15 patients and every person came from a different country. So it's almost like traveling around the world just by sitting in your room. So it's just that the possibility to be with so many different people and connect with so many different people. I think it really opens your mind and heart to all sorts of people. So that's what I particularly love about London.
Beautiful. And you have an eclectic career. So you are an oral surgeon, and you also are the founder of a Center of Compassionate Communication. You give workshops and counseling, and then you are also in a core. How did it all go, and how does it work for you in life to have these different interests so beautifully infusing each other, infusing your life?
Well, I think to do surgery full time is very. I preferred not to do it full time because for myself, I found I got less compassionate towards the patients because every day everybody's in pain and afraid. When I did it 6 days a week, by Friday I had no more compassion. If somebody was scared, I was like, less sympathetic. So what I found was actually working maybe 2/3 and having 1/3 to do other things. I found the other things renewed my energy to be able to be really present for people and caring. So that was one factor. And I love treating people who are sick. Communication is very, very vital because if you can really be present for them and receive them, it makes the treatment much more kind, actually, and much more. People feel much. If you can give them a connection, people feel much more cared for. So therefore, communication training fits very, very well. And then
You're the ultimate doctor of the future, really interested in communication with patients and really listening to the patient. How did you notice this? How does this change your interest for communication? How does this change the relationship with patients, and they enhances the treatment?
well, I think it really has an enormous impact if you are present, kind, interested, and listening. I have this very strong memory from when I was just quite newly new surgeon, and we had this patient, and I hadn't seen him before, but the nurses were all going, "Oh my God, he's a nightmare. He's very difficult." But I had about maybe 3/4 of an hour. So somehow the diary worked. I had 3/4 of an hour. So I said, "Look, you just go on a tea break and I will see this gentleman." So he came in and he'd had throat cancer and he'd had radiotherapy for the throat cancer, which had a very difficult consequence, which it dries all the saliva. So there's no saliva. So you can't swallow, you can't speak properly. It's very painful. So he was in a very, very difficult state and grumbling and complaining, but there's no treatment we could do for him. All the treatments had not worked. So we were just seeing him as a review, really. So anyway, he came in and I just thought to myself, I'm just going to listen to him. So I'm just going to receive his being, whatever he's saying. I'm not going to complain. I'm just going to give him this time. And so I just sat there, listened to all his troubles and difficulties. And after 3/4 of an hour, he was really happy. He was shaking my hand. He was smiling. Well, and then the nurses came back from their tea. They were like, what did you do? So I was just like, well, I just literally decided I would give him some time. Because of the way he was coming across, most people were pushing him away and not wanting to listen. I just thought, no, I've got this time. I can give it to him. And that was the medicine of just being present, just listening, just receiving him. And that was a long time ago, but it always stayed with me, how healing actually receiving another person's pain and suffering can be, and not shying away, not trying to fix them, but just allowing their life to be received, really. So that was one of my favorite early memories of why it's important.
And how did you get into compassionate communication?
Well, compassionate communication, 20 years ago, I went to a day seminar in London by somebody called Marshall Rosenberg. Have you heard of Marshall Rosenberg?
Non-violent communication.
Exactly. And I just went because I knew the person organizing the seminar. But I went to his day and he was very funny and very inspiring. And on the day, he said, if you practice this method, you will never hear criticism again. And I thought this was a very excellent wish. So I thought, if I'm never going to, because I hear criticism quite a lot, if I'm never going to hear it again, I'm going to follow this path. So that was and he actually called it non-violent communication, but also compassionate communication.
Yes.
So what I teach and what I practice is taken from Marshall Rosenberg.
Beautiful. So, it's a beautiful method. So can we get a little bit in it?
Yeah.
So to explain for those that don't know what compassionate and non-violent communication is.
So it's a path where you can, whatever anybody says, you can hear underneath what really matters to them. So instead of listening to their thinking and criticisms and blaming, you hear underneath and connect with what truly matters to them. And also from the speaking point of view, you practice to speak from a place where other people can actually hear you. So a lot of the time when we're upset or affected by things, we feel an instant impact. And often when that happens, what we do is we respond we react by criticizing and blaming and judging the other person.
Yes.
And that's not a good place to communicate from. So it really, really works well with rendezvousing in the present moment, because it's when you've noticed that impact of really, really slowing down, breathing, questioning what's happening here. As soon as you hear a critical thought of somebody else, it's to recognize, oh gosh, I've been stimulated and I need to shift where my energy is coming from. Otherwise, it's probably going to be a bad communication.
The problem is that the train goes very fast. So how do you stop the train?
The train goes very fast, yes. And the way to stop the train is to practice. So today you probably couldn't stop the train, but it's looking at your own patterns, your own behaviors, and exploring them. I always say at the beginning of our workshops, we practice cooking, we practice language, we practice musical instruments, but we don't practice, many of us don't practice this thing which is so vital to our lives. So it's taking some time out and looking at a situation that happened and replaying it almost in your mind. Should I give you an example, Catalina?
Please, and then go through the 4 steps so that people can. Yes.
Yeah. Okay. So I mean, all these things happen every day. Something happens every day. Quite a few things happen every day. So one thing that happened to me just yesterday, well, it didn't happen yesterday, but one thing I was thinking about yesterday was a very good friend of mine who I've known since I was a child. I called her a month ago and she has not returned the call. So I thought yesterday she hasn't returned the call, and then I can then go into criticizing and blaming this old friend, thinking, so the thoughts I would have, and we all have quite similar thoughts, the thoughts tend to be around how the other person is bad or there's something wrong with them.
It's the external environment, right?
Yeah, exactly.
Because it doesn't hurt that much.
No, it doesn't. It relieves some kind of pressure, but it doesn't get us into a good connection.
No.
So my thinking would be, oh God, she's always doing this. I don't know why I bother. I can't believe it. I help her so much. She should be grateful. Well, I'm just not going to call her again. This critical thinking leads to bad strategies as well. Like, I'm not going to call her again. Further down the line, it leads to I'm going to punch them. It leads to a violence when we start thinking what's wrong with the other person and how they've hurt us. Mm-hmm. So that's the first thing. And then I have to go, oh God, I'm criticizing and blaming. And one thing which is really, I think, really fascinating is when we are criticizing and blaming, it's not an enjoyable place to be.
No.
And sometimes in trainings, we'll say to people, think of one of your most critical thoughts. So what's a thought that you have often? Because we all have our own little script that just comes up every time we get triggered. So one of mine would be like, I don't like them. I don't like them anymore. So that would be a common thought. And we get people we say, we're going to do a meditation, okay? And we're going to meditate on one of our favorite critical thoughts. So meditating on, I don't like them. So we just get people to say this over and over for 40
But this time
seconds.
With conscious focus.
Yeah, basically, just saying, I don't like them, I don't like them, I don't like them, just for 45 seconds. And people really don't like it. And we ask them to notice what's happening in their body. And it's usually going tense and stressed, and the breathing's going constricted. And what's really amazing is most of us are doing that a lot of the day. But when you do it consciously,
it changes completely, yes.
You really notice the impact. But a lot of the day, we're having critical and blaming thoughts about other people. Yes. So noticing this with my friend, I have to make the choice of, is this getting me what I want in my life? Am I manifesting who I want to be in my life? And the answer is no. So it's kind of going, okay, so underneath these critical thoughts, what is it that I'm longing for? And I'm guessing, Catalina, you could even guess what I'm longing for.
And connection, and to connect with that person, right?
Yeah, it's very simple, but when you're lost in the thinking, it's not so easy to connect with. So
no.
Yeah, what I'm really longing for is connection. So it's to recognize the criticism and then to wake up to what I'm cultivating and think, is that who I want to be? Is that what I want in my life? Then actually sometimes it's very helpful to ask a friend, what is it that I'm really longing for? And it actually is connection and closeness and joyfulness. So It's then taking the step to cultivate that quality of being, of connection, of love, and then I'm in a different place altogether. And then I'm like, oh, she's always doing this. It's been going on ever since I've known her. With many people, what irritates us is always happening because that's who they are and this is who I am. So it's really looking underneath the criticizing and blaming. What is it that we're longing for? And it's not just an intellectual thing. It's really taking steps to cultivate that quality of being so you become that quality.
But Jill, this encourages slowing down, and not many people want to slow down.
Well,
we don't want to slow down because then we start feeling what we don't want to feel, right? Some uncomfortable feelings that might bubble up.
That's true. That's true. But at the end of the day, you have to ask yourself, do you want to spend your life criticizing and blaming other people? Or actually, some people criticize and blame themselves as well.
Yes.
So it's before I
and it's not even their own thought, of blaming, but they took this from a caregiver from the childhood. It's not even their own voice, if you like.
Yeah, and it's either at the bottom. It's either there's something wrong with the other person, or there's something wrong with me.
Yeah,
and it's a very boring record, actually.
Yeah,
but we have to, like you say, slow down and take a different approach if we are going to wake up from this trance, actually, of all this criticizing and blaming. So yeah, but also it gets very good results. So I think this is the good thing, that you get very good results when you change, and that's what can encourage you to slow down and rethink.
How long it's so for somebody that everybody's different, but what you see from your students, how long does it take to once you start learning this methodology and you start applying it in your own life, how long does it take till it starts it starts working better and better and you start seeing results?
And I think it depends on the person. So if you're already interested in rendezvousing in the present moment, you will have done a lot of things already. So therefore it's more easy. I think the main thing is the real practice. So if you practice every day, like playing the piano, if you practice something every day, if you reflect every day, okay, I got affected, recognizing my pattern, what am I thinking? What I'm thinking isn't true. It's just an expression of what I'm feeling at the moment, which is uncomfortable. And it's an expression of what I'm longing for. So I think if you practiced every single day, the effect would be rapid.
Yeah, you have slightly, a twist on the Rosenthal's methodology, actually, nonviolent communication, which I taught my kids 7 years ago. The last two, and it was very interesting. Well, they're teenagers now, and then but they're still, I see glimpses of it when they say, I don't like, you did this happened, this and this and this. So they look at the facts. This is, I feel upset right now, and I need you to leave the room. Just leave the room, or I will leave the room. And this, so you make a request of what you want to happen. How's your methodology? So if you go, how would this work on a one-to-one discussion with somebody? So not the inner dialogue that you are talking, but let's say in a dialogue with somebody else.
Yeah. Well, I certainly started with Marshall Rosenberg's 4 steps, but what can sometimes happen with the 4 steps is the most important thing is the energy you're coming from.
Yes.
So if you do the 4 steps and you're coming from a reactive energy,
it's not going to work.
No, because the people hear the energy, they don't hear the word. So that's the disadvantage with the way some people use the 4 steps. Marshall Rosenberg was very in his compassion. So his 4 steps were imbued with compassion. So, but the most important thing is to get oneself from reaction to a different state. So shall I tell you another example in real life?
Yes.
So another example in real life. I was working with a nurse. I really like to treat people who are awake. So most of my patients we treat under local anaesthetic. And so the patient is present for the whole thing. So I was working with this nurse. It was a tricky, one of the things we do is remove wisdom teeth. So I was taking out a particularly tricky wisdom tooth, and my nurse was not kind of working with me as well as I would have enjoyed. So she was kind of, when you're taking out wisdom teeth, you have to, it's slightly graphic here, but you have to suction the blood away, otherwise you can't see, basically. So she wasn't really suctioning the blood, so I couldn't see. So this was a difficult situation I was in. And I started to think to myself, oh, you know, this is hopeless. She's rubbish. Why am I working with this rubbish person? You know, I'm going to complain. I can't work with her. Again, you get extreme. I'm just going to say I can't work with her again. So, and then I noticed to myself, I was tense and she was not getting any better. I was communicating in my words. I was saying suction, but the way I was saying it was
the energy suction.
Yeah. It was not nice. It wasn't nice, and she wasn't responding, not surprisingly, to my angry energy. So then I was like, okay, when there's a patient involved, it's always very motivating. It's like, okay, we want to give the patient the best treatment, and this isn't the best treatment. So I'm thinking these critical thoughts. What is it that I'm longing for here? What I'm longing for is for collaboration, support, smoothness, a kind of unity of connection between me and my nurse. So I had this, and then I was like, okay, so I'm going to manifest this now. I'm going to act as if this is true. There's connection here, there's cooperation. It's like a ballet. Surgery is like a ballet when it goes really well. We're doing a ballet together. And guess what happened?
It's transformed the whole experience.
She started, I didn't even need to say anything.
She felt your sweet,
Yeah, I didn't even need to say anything, but she immediately started to act in the way that I would have wished. But it's more invited into my energy rather than attacked by my angry energy. So that's an example for myself of.
So take a spouse, or imagine you and your wife and your husband. So a couple. So what would give us an example of a more effective communication when one of them is not in a resourceful state, or both of them are not in a resourceful state, and they put basically gasoline on fire?
Yeah. This is very, very common, and very, very common for all of us, I think. All the time, people are having reactions because somebody says or does something that they don't enjoy.
Yes.
So, okay, so, I mean, even my husband, we trained in this together 20 years ago. I think it's really supported our marriage. But even still today, we will have a reaction. So, and believe this or not, because we see a lot of couples argue around time, and also
money
and tidiness is a big source of. One person prefers a house to be more ordered, one person prefers more. But I'll give you a time one, because my husband is very keen on timekeeping. And I'm not so keen on timekeeping. So we had an appointment with we had an appointment with someone. I think it was the day before yesterday, and we had to leave in 10 minutes, and I was still in the bedroom. So he came to the bedroom and said, in what I considered quite a tense voice, we've got to go in 10 minutes. If I wasn't so resourced, I could have gone, well, I'll be ready in 10 minutes, or stop hassling me, or stop nagging me. That could be an unresourceful place that I could have spoken from. But in that moment, I'd just been doing yoga. So I was breathing and in spaciousness. So I took a deep breath and I was like, oh, okay, I'm going to be ready. I'm just coming down. So that was a little moment of choice.
Of choice.
Yeah, exactly.
You go right or go left. Yes.
Yeah, the choice is the most important thing, because often we miss the choice, and once you've missed it, takes much more strength to rewind. Because when couples are
arguing,
both people think the other person's wrong and they're right, and you have to take yourself out of the right and wrong and actually imagine what the other person wants.
Yeah.
We were on a plane once, and we'd had this difficult, we were in the, oh, it's your fault, no, it's your fault, oh, you're always like this, no, you're always like that, oh yes, oh no, kind of in that energy. And I do remember kind of doing a deep breath and breathing and going, is it that you'd like some consideration? And the spell gets broken. Yeah, but not always. Sometimes you have to do more than that.
And this moment of choice is so important. So there were moments in my life, of course, I went unconscious and I would go in the train and I was blah, 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 blah. But then, of course, in time, as I became more aware, I started to realize the existence of this moment of choice. And sometimes I noticed the moment of choice and I still went on the old route. But there was a difference, because I realized, oh my God, that there is a moment when I can change my behavior. There is a moment, I didn't take it, but next time I know it is there. So this is, for me, it's been also, and it's still a path, right? Because sometimes I go unconscious and I just go into the train, but I know there is a moment and I'm open myself to that moment, to connect with that moment, and then get the choice and live in freedom, because that's freedom. That's very important.
Yes, okay. And I think also, Katerina, it really connects with your rendezvous, because in that moment you are in the present.
Yes,
and
absolutely.
If you go down the old track, you're just repeating the history.
Yes.
So in that moment, there's a phrase I love, and it says, if you take care of this moment, the past and the future will take care of themselves.
Absolutely.
Yeah.
So it's been fascinating. So let's
shall I tell you one more exercise that we do, which helps with the practice? So it's to find the things that, say your partner says to you, that you find the most tricky. So it could be, you're late, why don't you tidy up? All sorts. We all have our own little things that our partner says that we find difficult. They could be criticism. One of my friends, her husband, expresses his criticism quite freely. So, and it's to find the thing that really affects you, because some of us are affected by some things and some not. So find the thing, and then to get a friend to practice with you. So to say, why are you always late? If that's it. So why are you always late? And you get a chance to feel the impact and the moment's choice, and the practice to say back something like, oh gosh, so you're really keen that we get there on time, or something. And it's good because it's not the intensity of the moment with the
But you
real
prepare,
person.
yes.
Yeah. So
it's like preparing, like athletes preparing for competition.
Yeah.
Or for, public speaking or whatever it is. Yeah, that's a wonderful one. And I like also the meditation of that things that affects you, because the moment you keep repeating it consciously, it's dilutes its power.
Yeah.
So let's end up with you summing up the steps of your methodology for people to remember and to practice.
Okay. So the steps. So I think the first step is to connect with one's intention in one's life, that one wants to live from a place of presence and freedom, actually. So that's the most important, one's intention for presence and freedom. And with that intention, to begin to notice when we get stimulated, and we literally get stimulated
many times
a day. Exactly.
Yes.
So
Yes.
maybe just to take one stimulation a day, and to recognize, okay, so I've been affected here. What am I thinking? What's going on in my thoughts? And I will be criticizing either the outside or the inside.
Yes. Mm-hmm.
And then just really taking a deep breath and saying, oh, what is it that I'm longing for underneath this? And really, and maybe asking a friend, but really connecting with this deep, and what Marshall Rosenberg said, which was very compassionate, was that everything that anybody does or says is an expression of a deep longing.
Yes.
Quite often it's expressed tragically, in that we put it in a way that people can't hear us. But it's to connect with underneath. We're all longing for connection, love.
Exactly. And we have the same need or intention, and the behavior is the problem, where the conflict is.
Yeah. So and then once we've connected with what we're longing for, it's taking the steps to cultivate that quality.
Mm-hmm.
So that's for ourselves. But then also, if we're looking at another person and they are expressing criticism towards us, it's to really not to get caught in believing what they're saying, because nothing that anybody says when they're in a reaction is true. Mm-hmm. So it's just hearing it as an expression of distress, and listening underneath to what matters.
Yeah. What do they need in that moment? And what do I need?
Shall I tell you a very quick work?
Yes. Yes.
Okay, so people coming for surgery usually aren't in the best state of mind. So I had a man and a lady was with him, and I went to get them from the waiting room. And the first thing the lady said to me was, if you hurt him, I will smack you one.
Oh. No pressure though.
I was like, fortunately, I've been practicing compassionate communication here. So what I did was I took a deep breath and I just said to her, oh, so you just want everything to go really well this morning, do you? And she's like, yes, I do.
Yeah. Yeah.
And it's so compassionate to go there.
It's a deeper level of being and of communicating with somebody else.
Yeah.
Yeah. Beautiful. Oh, Jill, thank you so much. Thank you so much.
Yeah.
It's been a pleasure and very useful, and I hope that many got inspired as well, in terms of emotional management, but also in terms of communicating with others in a more profound and more effective in more effective way, in a way that also improves the relationship.
Yes.
Because compassionate communication improves the relationship in the end.
Absolutely. Improves the relationship and improves the quality of your life.
Yes.
Yeah.
Thank you so much. Would you like to
thank you so much.
Guide us to end this experience together? Would you like to guide in a short meditation? Or you don't have to. I can do it. Whatever.
Yeah, okay. I'll guide us in a short meditation.
Yes, let's do that, sister. Okay.
It's been really fun to share.
Yes, it's been a pleasure. I love it. Thank you. So
Okay.
go ahead, Jill.
Okay. So if we just close our eyes and just take a deep breath. Just feel our contact with the earth, contact with our chair, and taking our attention to our heart area. And connecting with the love in our heart. Just really feeling the energy of love. And just noticing that energy radiating out from our heart in all directions. And touching the people around us and the people beyond. And connecting with a thank you to our heart for bringing this love into the world. And taking another deep breath and opening our eyes.
Thank you. You're the first surgeon that guides me in a meditation. Thank you so much. And Jill, I take a lot forward in my life. It's been a precious moment for me. And I hope the people that watch with us and the people that will watch the replay will find many jewelries to use in their lives. Thank you so much. And I hope you'll come again, Jill.
Thank you
Have
so
a
much,
wonderful,
Katarina. Lovely
have
to
a
meet
wonderful,
you in
thank you.
this direction.
Yes, and
Yeah.
have a wonderful weekend. And bye bye, everybody. Thank you for watching with us, and thank you for watching the replay later. And enjoy the weekend. Thank you. Bye.
Thank you. Bye bye.
Bye.